A very good day to you and warm welcome to Health Talk, your weekly dose of analysis of current health issues. This is SABC News on DSTV channel 404. I'm your host, Dr. Sello Mutaou. We continue our focus on women health issues during this month. Today we discuss oral health and cosmetic dentistry. But first, we look at current health stories making headlines. Now, a fever of unknown origin has killed 13 people in the northwestern parts of the Democratic Republic of Congo, this since August the 11th. All 13 had suffered from fever, diarrhea, and vomiting. And just before succumbing to this short yet unidentified disease, they had reportedly been vomiting some black-stained material. Now, according to the World Health Organization and the medical charity Without Doctors, MSF, it is too soon to tell whether or not this outbreak of hemorrhagic gastroenteritis is as a result of Ebola. In the meantime, the highly contagious Ebola epidemic is continuing to ravage the West African region. Now, for a latest update on the epidemic, let's take a look at this report compiled by Wandile Mofokeng.
African countries tightened travel caps on Thursday in an effort to contain the Ebola outbreak, ignoring World Health Organization's warning that such measures could heighten shortage of food and basic supplies in affected areas. South Africa has since issued an Ebola travel ban this week, which will affect non-South Africans traveling from West Africa. Health Minister Aaron Motsoaledi said that South Africans traveling from these countries would be subjected to a comprehensive health questionnaire and a medical exam if necessary. This bans come just after it was reported that tourists traveling from eastern countries cancelled their trips to South Africa out of fear that they might contract the deadly virus. The World Health Organization said on Friday it has drawn up a draft strategy plan to combat Ebola in West Africa over the next 6 to 9 months, implying that it does not expect to halt the epidemic this year. More than 1,300 people have died this year from the virus in the worst ever outbreak, and the World Health Organization has faced criticism, including medical charity Medicine Sans Frontiers, that it has done too little to fight the disease. Efforts to curb the deadly Ebola epidemic that swept across 4 West African states are being undermined by the lack of leadership and emergency management skills, the international head of Medicine Sans Frontiers said on Thursday. Doctors Without Borders said the world's worst ever outbreak of Ebola caused widespread panic and the collapse of healthcare system, particularly in Liberia, where pregnant women have lost babies while seeking a safe place to deliver.
Okay, now back home. In an effort to improve maternal health and reduce child mortality, the South African Health Minister, Dr. Aaron Motsoaledi, on Thursday launched Mom Connect. Now, this is a cell phone-based app to register all pregnant women in the country. This with the aim of assisting and supporting them throughout pregnancy, childbirth, and beyond. Tamim Bogan has more.
Mom Connect will ensure that pregnant women are not just passive recipients of healthcare, but are also active participants in claiming healthcare in public health facilities. All registered pregnant women will receive SMS messages appropriate to their stage of pregnancy. The messages will advise them on what to do at any stage of their pregnancy.
Yes, well, in Mom Connect, we are calling over all pregnant women to register. We are going to advertise via the media. We've got health workers calling them. They must register at the nearest clinic where they'll be going for antenatal care, or what normally people just call maternity clinics. We want them to register there. All health workers have been taught. We have trained 10,300 health workers who will inform mothers about how to register. In the next few weeks, every single health facility will be having at least one person who is trained and who is able to register these pregnant mothers.
20 years old Tresha Mashishi from Soshanguve is 2 months pregnant. She is registered for the new cell phone application, which will ensure that she receives quality health services.
It made my life easier and my baby too, because we will know more. Go to the consultations for the therapist when you have a problems. You just send them an SMS request and they will answer you so fast. So everything will go positive.
After delivery of the baby, Mom Connect will still continue to provide information for up to a year.
Yes, the message is even after delivery of the baby will continue for 1 year because that will be focusing on the baby and we want to take care of that infant for a period of 1 year.
The SMS messages will include advice on the baby, like exclusive breastfeeding, immunization, and family planning. Mom Connect is an innovative program to ensure that technology is optimally utilized for the better grassroots results. It is a step in the right direction.
To further simplify it, this is how the registration to Mom Connect works. First step is that the nurse confirms the pregnancy at the clinic. Next, the help will then help the pregnant female to register by dialing *134 *550#. Then the pregnant mom would answer a few questions about her pregnancy. And then finally, the pregnant mom is then registered and connected. Now, all this is stored in the registry of the National Health Department in a national database. Now, as we said before, the pregnant mom will receive weekly messages to advise them on pregnancy and issues relating to the health of the baby from childbirth up to the age of 1. Now, also remember that if anyone in your family has TB, an example of a message like that would be something like TB. For instance, if anyone has TB in your family, you'd be told that you need to contact the health facility so that they get treatment that will protect you and the baby. And remember that the friends and family can also join Mom Connect by dialing that number again, *134 *550#. Now, on a different story, more underprivileged South African families are to receive health care at home. Now, that's according to Professor Yanni Hugo, a passionate advocate for community-oriented primary care, or COPC. Professor Hugo is a family physician and associate professor in the Department of Family Medicine at the University of Pretoria. And he now joins us in our Pretoria studio to shed some more light on this COPC initiative. Professor Hugo, welcome to Health Talk.
Welcome. Thank you.
Now, Professor Hugo, just tell us a little more about this community-oriented initiative of yours.
Community-oriented primary care is a well-known concept that was practiced in South Africa 70 years ago already. It is practiced internationally, but it is about moving the focus of care from the clinics and hospital to the home, where people mostly experience their health.
Is it about taking healthcare to the people? In other words, taking curative services to the people, or is it more geared towards preventative healthcare?
It looks at healthcare comprehensively. The promotion and prevention is important, but especially the early detection and assisting in the management of conditions. It is all involved with that. It actually links what happens at the home with what happens at the hospital and the clinic. The example of this Mom Connect that was just on the report there, with COPC, we actually have the health team visiting the home, assessing the situation, and responding to the issues that emerge at home and in the community. It also assesses the health of a whole community and then develop interventions based on that assessment.
You said something about a health team visiting the homes. First of all, who is the health team?
This is what is called the ward-based health outreach team, which is meaning a municipal ward, which most of the members are community health workers. They are managed by a professional nurse, and they are supported by doctors and other professionals. So the community health worker is the extension of the health team that goes into the home, builds a relationship with the people, identify the problems, advise and refer and bring the the family or the people who need it to the clinic or take them back, make sure that they have the medicine, and this is all in a team setup. The family is part of this team and takes more responsibility for their own health.
Okay. Now, how does this initiative interlink into the National Department of Health's initiative to re-engineer primary healthcare services, particularly with regards to the district health service? Is it separate from that, or is it something that complements that system?
It is a core part of the district health system. But for the first time, the re-engineering of primary health care through the ward-based outreach teams created the possibility of reaching into the homes in a very organized and planned and sustained manner. So this is a core element of the re-engineering of primary health care. But the integration of this service into what happens at clinics, at schools, at hospitals is crucial. And this is why we've got the same doctors that would go to the hospital, the clinic, will also go to the homes. We've got the cell phone technology that links the information from the home with the clinic and the hospital. So it's in a way giving the health service feet directly into the community, but not as a separate program, but as an integrated program into the district health service.
All right. You say that it's been practiced in South Africa for over 70 years, but it's reported that you ran a pilot in the Tshwane district between 2011 and 2013. Any feedback from that pilot, or any lessons learned from that pilot?
Yeah, that was very exciting. Around about 2011, with the re-engineering, we initiated this with the assistance of the Foundation of Professional Development and District Health. In 7 sites in Tshwane, we had around about 80 community health workers, 7 teams. We worked with about 20,000 families, and we really saw that this is possible. We could relate to people, we could identify many diseases, especially tuberculosis, of people that would never go to the clinics, and we could show that this is possible. It reduced the impact of TB and other illnesses, and that made it possible for us to plan bigger projects and look at implementing this for the whole city in the future.
So what's the future like? Do we see this initiative being rolled out throughout the country?
Yeah, ward-based outreach teams is implemented in all provinces. In Tshwane, which is an NHI pilot site, there's a strong partnership between the city of Tshwane, the District Health of Gauteng Department of Health, some NGOs, and the University of Pretoria, where we systematically implement this in most of the needed communities with a planned program of going to the homes, having teams, the cell phone systems, the information systems, the integration of information, the analysis of results, the analysis of interventions. It's creating a research platform in which we are now looking at addressing TB, HIV, maternal health, and many other problems, chronic diseases.
Yeah.
And it's done in a way that can be rolled out in the whole country.
All right. There we're going to have to leave it. Thank you very much, Professor Hugo, for your contribution. That was Professor Yanni Hugo from the University of Pretoria telling us about the community-oriented primary healthcare initiative. Now, spinach is one of the most affordable and nutritious vegetables for the consumer. In a bid to contribute to health promotion in all communities, Dr. Spinach has devised an innovative spinach-based nutrition program. Tembi Majombozi compiled this insight.
Spinach, the green leafy vegetable. Spinach supplies our bodies with essential minerals and vitamins. Spinach can help prevent development of cardiovascular diseases and certain cancers in our bodies. These diseases are common in South Africa. Lufefe Nomjana is 26 years old. His dream is to promote healthier living in Khayelitsha. Lufefe runs a business called Espinacha. He adds spinach to his bread and muffins.
I started my business with only 40 rands on my pocket and my intellectual capital after waiting for so long in the queues for financial assistance. So I've never had or got any opportunity to actually being funded. So I just leveraged what I had. The intellectual capital led me to a mother next door, and I started it with someone's oven. And then from someone's oven, I grew the business. In 2 months, I was sitting on actually 50 breads sold.
People who are less informed about healthy lifestyles have changed. Spinach gives us vitamin C, calcium, vitamin E, vitamin B6, vitamin B2, copper, manganese, iron, folate, and many other nutrients. Spinach is affordable to families in poor communities.
I go to them, I supply them with bread. I've got a model that I've actually created, which is called cross-supply model, where I give you the seed, then you plant the spinach. After the spinach is growing, then I can come actually and buy spinach from you and sell you the bread cheaper. So that's the relationship I have with the ECDs, and the reason why I've actually created that relationship. It's mainly because of like looking at the future of this country, which is more at the hands of the children.
Espinaca has made a lot of difference because it brought about an alternative for where we can able to go to eat. As you would look in most of the township, you would never find, there's no place where you're able to go and find only vegetarian food without meat. But also Lufefe has been a driver for eating more healthier and a healthy lifestyle also.
Lufefe is passionate about promoting good health to younger people. He encourages the youth to live healthy lifestyles to prolong their lives.
Very, very, very inspiring indeed. Okay, we're going to go for a break now, and when we come back, we now discuss oral health. Please stay with us.
Let's do the voice balance first. Just count 1 to 3. Or
1 up to 5.
When was the last time you ate a spinach?
Yesterday.
Yesterday.
1, 2, 3. 1, 2, 3.
Are you happy, Machi?
Good part.
All right, sure.
Good.
Welcome back. You're watching Health Talk. Now, it is said that oral health is not only about healthy teeth, it's a critical component of general health. And put simply, you just cannot be healthy without oral health. Now, let's take a look at this insight by our producer, Tando Ngumalo.
Oral health is a state of being free from mouth and facial pain or deformity as a result of diseases that affect the oral cavity. The most common oral diseases are infectious dental conditions such as caries, cavities, gum disease, and trauma from injuries. Worldwide, 60 to 90% of school children and nearly 100% of adults have dental cavities, often leading to pain and discomfort. Across the world, 16 to 40% of children between the age range 6 to 12 years old are affected by dental trauma due to unsafe playgrounds, unsafe schools, road accidents, or violence. 1 out of every 5 middle-aged adults suffers from severe gum disease, which may, together with dental cavities, result in tooth loss. Complete loss of natural teeth is widespread and particularly affects older people. Globally, about 30% of people aged 65 to 74 have no natural teeth. Risk factors for oral diseases include unhealthy diet, tobacco use, harmful alcohol use, and poor oral hygiene. Tobacco and alcohol use are major causal factors for oral cancer, more common in older men and among people of low education and low income. The burden of oral diseases and other chronic diseases can be simultaneously decreased by addressing common risk factors. These include decreasing sugar intake, consuming fruits and vegetables, stopping tobacco use, and decreasing alcohol consumption, maintaining proper oral hygiene, using protective sports and motor vehicle equipment, maintaining safe physical environments. Dental cavities can be prevented by maintaining a constant, optimal level of fluoride in the oral cavity. Fluoride can be obtained from fluoridated drinking water, salt, milk, and toothpaste, as well as from professionally applied fluoride or mouth rinse.
Okay, for a discussion on oral health, we're joined in our Johannesburg studio by two beautiful ladies. First is Dr. Matsidiso Mutupi, who's a prosthodontic specialist for Wits University, and Dr. Komotso Sepeng, who's an aesthetic dentist practicing in Pretoria. Ladies, welcome to Health Talk.
Thank you.
Let's start off by, defining some of these difficult terms. We're not used to, look, we tried to define what oral health is, and I think we pretty much have a good idea. Now, we hear this, maybe let's start with you. You're a prosthodontic specialist. What is prosthodontics?
Prosthodontics is a specialty of dentistry, which actually deals with rehabilitation of oral defects, and that also includes some of the maxillofacial as well, maxillofacial defects that people experience. And that is done by using what we call prosthesis. That's why we call prosthodontists, which are really removable kind of restorations that we're using. And that can be intraoral, which means in the mouth, and some of them can actually be on the face to replace some of the missing structures in the face.
And orthodontics?
Orthodontics will be dealing mainly with also what we call malocclusions here as well, and also they also rehabilitating and looking at the facial, some of the facial growths as well, which is why when you're looking at children that will have teeth that are not well aligned, or when they're having teeth that are actually overcrowded sometimes. These are the kind of issues that orthodontists will look at.
All right.
And that's not limited to that.
We're going to try and keep it simple and not confuse people out there. Dr. Sepeng, you said to be a cosmetic dentist or aesthetic dentist. Just tell us briefly about this concept. Is it a specialty?
Okay, cosmetic dentistry is not actually a specialty, true specialty in dentistry.
Yeah.
It's sort of a special interest. There are diploma courses that are available, but it's not recognized as a specialty.
Right.
So cosmetic dentistry is mostly involved with when you have no disease in you, in your teeth, but you just want to make your teeth look nicer.
Yeah.
And then
you just want to beautify.
Yeah, you want to make the smile.
Improve your smile, as it were.
Yeah, it includes working on the teeth and also working on the gums, where you can reshape the gums to make the teeth look more beautiful.
All right. Is there some kind of association of cosmetic dentists? I know that in general medicine there's an association of cosmetic doctors. Is there something similar with dentists?
Yeah, there is a study of a group study of aesthetic dentists.
Yeah.
Yes, there is.
I see.
Yeah.
Okay, let's get back to you, Dr. Tsidi. The normal teeth. Just tell us about what is normal in the mouth and about the teeth. You know, from I suppose childhood into adulthood.
Just to add, I think I'm just excited that you started by saying oral health is not about teeth, but obviously teeth makes quite a big part of oral health. But just to highlight as well that when dentists are dealing with, for instance, in the mouth, you've got the tongue, you've got the palate, you've got all the other structures that are there, and we need not to lose focus of that. But obviously, as your question comes back to the teeth.
Maybe before we get there, because it reminds me now of other things. You're saying that dentists don't just look at the teeth, but they look at everything else in the mouth.
Yes.
There's a group of professionals called dental therapists. What is the difference between a dental therapist and a dentist?
We do have a lot of oral health practitioners. And maybe just to highlight that we do have people that are called oral hygienists, which their scope will also be limited to, for instance, cleaning of the teeth and what we call scale and polish of the teeth. And they also do some other preventative work as well.
Right.
And also dental therapists are also dental health professionals as well.
Okay.
Their work as well is limited to certain procedures that can be done by also the dentist and themselves, but there are certain scope that they cannot cover, such as, for instance, making dentures.
All right. Now, let's just leave it there because we just need to go for a break quickly. And when we come, we'll continue our discussion on oral health issues. Please stay with us. All right. Firstly, the time. How much time do you have?
The second segment, how long do we have?
You look at me. Okay. Huh?
7 minutes.
7.
Yeah.
Shoot.
We want you to tell us.
The many factors that are hidden from the public in terms of this ought to be brought out by the media.
Watch Media Monitor with me Sundays at 9 a.m. only on the SABC News Channel.
Welcome back to Health Talk. Now, Dr. Sipeng, you know, before we talk about reconstructive and restorative dentistry, let's talk about the common problems that occur in the mouth.
Okay. In the mouth, there are basically two diseases. It's the cavities, the caries, or the gum diseases. So the caries is when the teeth themselves, the hard part of the hard material, has cavities. Where bacteria in the mouth produce acid that's going to eat away at our tooth structure.
Yeah.
And this is when
so
you get...
in simple terms, the tooth gets rotten and it develops cavities and stuff. Okay. And we spoke about the causes. We showed the insert there that, unhealthy lifestyles and so on. The second commonest problem you said was?
It's gum disease.
Gum disease, okay.
Yeah, this is the part of the disease process that's affecting the supporting structure of the teeth, being the gums, the bone that's holding the teeth itself, and the ligaments that's supporting the tooth inside the bone. So that's gum disease, where you got bleeding gums, your gums start going down.
Right.
That's called recession. So that is, and then your teeth can be loose from this gum disease.
All right. Dr. Msupi, are there any other structural things that can go wrong in the mouth?
There are many. When we look at also trauma, for instance, where somebody can fall and actually sometimes have a fracture on the tooth. There are other issues as well where people, something like bad breath, where people are coming and say, I've got bad breath, which
That's
might
a difficult
be
one, eh?
actually
Yeah.
originating as well from the same problems that she's been highlighting here.
Right.
Sometimes as well, you might find that, especially now if I have to go to the specialty where people have trauma as well, and you have fractures of the jaws as well, which actually might even need more surgical intervention from also our other specialty, which is maxillofacial surgeons.
All right. Before we get back, I need to just, go back to Dr. Sapeng about, we spoke about those two common issues that happen in the mouth. How can we prevent these things from happening? How can we prevent gum disease and tooth decay?
Okay, the prevention of both is similar. Prevention is by obviously brushing our teeth at least twice for 2 minutes, brushing our teeth twice a day, flossing daily, having a healthy diet, avoiding lots of sugar, sweets, especially in young children.
Let's talk about sweets and sugary stuff for a while. I believe there are these bugs that we all have, that apparently like sugar, and they turn these things into acid. And just tell us a bit more about that.
Okay, that is the process of developing a cavity. We have bacteria in our mouth, and then when we don't brush it, especially at night, we don't brush, we sleep. The whole day you've been consuming sweets, Coke, whatever that is that you were drinking during the day. These bacteria, they come out and then they feed on what is in the mouth. And as they feed, they produce an acid. And then this acid, it goes into the tooth, and then it starts eating away the tooth. It demineralizes the tooth. And then that's how you develop a cavity.
So the worst thing you can do is to have sugary stuff and sticky sweets at night and sleep in that state without brushing
and flossing, yes.
Okay. All right, back to you, Doctor. Now, the reconstructive partner. Clearly, this is what you do. Do you want to perhaps just share with us the type of work that you do to help people restore normal function?
Maybe even to add to what she was talking about now with prevention.
Right.
Because a lot of reconstructive work that we're doing is because of cancer, the tumors that we find in the mouth, oral cancer.
Yeah.
And because of lack of prevention, we find that people often present with quite huge, extensive diseases, which if it was caught at an early stage, it could have been treated or managed better. So I think just to start there as well, that by going for dental checkups as well, this is where your dentist or your specialist will have a look and will actually see if there's anything that worries them.
How often should one go for a dental checkup?
We normally say twice a year, once in 6 months, but also I think that it's also individual based because there are certain people that are prone to certain diseases. For instance, there are certain genetic predisposed individuals, and some of the health problems such as diabetes, you find that these people often have gum diseases, for instance. So after speaking to your general practitioner, or your dentist, or whoever practitioner that you are attending to, be it your oral hygienist, your dental therapist, as you've said, one needs to ask, how often must I come? And then that will be explained to you.
Okay. Then talk about, I hear you saying go for a dental checkup, but are there things that one can look at? Something that if you notice, you then need to go to a dentist, obviously without waiting for pain.
Yes. Sometimes there's changes in the mouth, which maybe it can be the color of the gums. Sometimes it becomes reddish, and you worry that, sometimes the gums start to bleed. And there's certain instances, unfortunately with cancer, you might find that people are not even aware that there's changes, maybe because it's under your tongue or it's somewhere hidden between your cheeks. Okay. So often you find that it's not that obvious. But there are certain changes of color, changes of saliva sometimes that you don't have, you feel like you don't have enough saliva in your mouth. Right. So these are the things that one can actually present to the dentist when they see.
Okay. All right. Caries and cavities and broken teeth. when we talk about the concept of restorative dentistry? Just basically, what is that?
Okay, when we restore teeth to their normal function, if you have caries, your teeth are decayed, the dentist or the practitioner will go in there and remove all the carious part of the tooth.
Yeah.
Then thereafter you can put in a filling, a normal filling, which you can do inside the rooms.
Yeah.
Or if you feel that the tooth was extensively broken down, there are other fillings that can be done at the lab, things like onlays, or even a crown if you feel that you don't have enough tooth structure from the tooth itself.
All right, okay, it's fine. Just hold it right there because I want us to continue on that when we come back. We go for a break, and when we come back, we now focus on cosmetic dentistry. Welcome back. If you just joined us, this is Health Talk on SABC News, DSTV channel 404. Today we're discussing cosmetic dentistry. Now, cosmetic dentistry is generally used to refer to any dental work that improves appearance, though not necessarily the function, of a person's teeth, gums, or bite. This appears to be gaining popularity with more and more people seeking to improve their smiles and looks. Our producer, Tamim Bogane, has more.
Over time, teeth can become stained or discolored. This is caused by unhealthy water, smoking, taking certain medication, or tea and coffee. A skilled, experienced cosmetic dentist can help to improve your appearance, your smile, even your self-esteem and confidence. Cosmetic dentistry is aimed at creating a positive change to your teeth. It whitens and bleaches the teeth. Dentists also use dental implants. Cosmetic dental procedures can be very costly. They have become widely available in the past few years. There is a high demand for such treatment. It is important to know the benefits and risk in undergoing cosmetic dental procedures. For those with sensitive teeth, tooth whitening is not recommended. Meanwhile, reshaping cracked, chipped, or overlapping teeth is a daunting procedure with good results. Are you one of the people who are not happy with your smile? There are various treatments available to beautify your smile.
Interesting that cosmetic dentistry is said to be gaining popularity. Now, dentists have not been popular people for a very long time, simply because, I mean, it's terrifying to walk into a dentist with all these instruments and this huge light over you. How do you guys make it friendly, user-friendly, even for children to come and visit you, just to come and check your teeth? Okay. Even before we get to the cosmetic part.
It's good that people are not coming to us only when they have pain and sepsis, but they actually come when they just want to make themselves look good.
Right.
Yeah, cosmetic dentistry is gaining popularity over the years, and it's anything as basic as cleaning your teeth. I mean, if your teeth are, you can see that this person, his teeth are dirty and all that. Cleaning the teeth, it's part of cosmetic dentistry. Replacing missing teeth, that's part of cosmetic dentistry, where you want to make your smile look more beautiful. And there are many procedures involved in cosmetic dentistry. Some of them are part of basic dentistry, and some of them are more advanced. Like,
let's talk about the commonest one. I believe tooth whitening would be the commonest. Tell us about it.
Okay, tooth whitening will be where you come into the dental rooms, and we have to check you that do you really need to bleach your teeth, because people look at magazines, then they feel that they all need to bleach their teeth to be white. And you find that African people do have very white teeth. And
By bleach, you don't mean using bleach that you use in washing? Eh?
No. We use chemical hydrogen peroxide.
All right.
And then when it's done in the office, we use a higher concentration of the bleach so that the dentist must protect your gums and then apply the bleach onto your teeth.
Yeah.
And then there are also take-home procedures where the patient can take the bleach at home.
Yeah.
It's a lower concentration of bleach, so you can also do it at home.
Now, what sort of people come for teeth whitening? Is it males, females, young, old?
I would say it's mostly females, 30s to 40s, that age group. Those are the people who request bleaching mostly.
Yeah. And what is the cost associated with tooth whitening?
I don't want it. It would depend from area. It would depend on the material that is being used. So I don't want to say it's going to cost 2,000 rands or 5,000 rand. It depends on what the dentist is using. Is it in office? Is it at home? Is he going to use a light on it? So it depends on what he's using.
Okay, so what I gather is that the price ranges from about 2,000 to 5,000 rands just to whiten the teeth.
If you say so, yeah, it's somewhere there.
Well, I got that from you. All right. Dr. Mtupi, obviously the cosmetic part is in somebody that wants to just change appearance, all right? And it is not meant to be painful, I can imagine, because otherwise people wouldn't be coming for it. But the other bit that now involves having to, put other, say somebody comes with missing teeth because of problem X or Y. What actually happens then?
I think also what is important to add there is that aesthetic dentistry is a big part of prosthodontics as well, and also orthodontics, by just rehabilitating, by doing what we're doing. Therefore, for somebody who will come with a missing tooth, by just giving them a normal plastic denture tooth, that will change that person's look, and therefore that will change their aesthetics and improve their self-image. And, people have said, I found a job after I got this tooth that you gave me. So there are a lot of procedures that we do as part of rehabilitation, such as the crown and bridge work that we're doing.
Tell us more about crown. What exactly is that?
A crown is if the tooth is badly broken down from, for instance, caries or trauma, like we said earlier on. One can actually just shape and take out the caries and then put a cap, in simpler terms, which is a crown. And this crown can be different materials. We've got metal with porcelain. We've got some of them that are porcelain that will be more aesthetically better than the one with the metal underneath it, which are used more on the anterior teeth. And sometimes then with these crowns you can have bridges if you have to replace even a missing tooth in between those teeth that are having problems. Sometimes if it's just a minor, for instance, certain patients will come with fluorosis, which is discoloration of those teeth. So one can do veneers, which really is just to take off only the anterior or the front part of the tooth and shape it so that you can get a better aesthetics from that.
Talking about implants, she mentioned something about metals. And I believe that I don't know whether there's two schools of thought within dentistry, that others are moving away from the metals to other material that doesn't contain metals. Any truth in that?
That would be mostly for crown and bridge work, where in the past the crowns inside they used to have a metal core. That metal was mostly for strength, to give strength to the crown itself or to the bridge. But these days we've got new materials like zirconium, which are just as strong as the metal. So we've got a zirconium-based crown or zirconium-based bridges. So that's the metal and the non-metal. Okay. And then implants would be where you have lost a teeth or teeth, where actually a titanium screw is put into the jaws themselves, and then over this you can put in a crown or a bridge.
In the past, gold used to be popular, and I'm told that people are moving away from that. Any reason?
Just to add, I think what you were talking about earlier when you said people are moving away from metal, it's not necessarily the metal that's in the crowns.
Yeah.
It's what we used to call amalgam. Amalgam restorations, that is where there is a lot of discussion around that. And now people are moving more to composites, which are white fillings.
Yeah.
So I just thought also just to clarify and add that part as well.
All right. The one part we didn't talk about is repairing, broken teeth, chipped teeth and that sort of thing. How do you guys repair that?
Okay, if you present with a broken tooth, we can do a filling inside in your mouth in the dentist chair, where you use composite filling, which is the new fillings that are white colored, that are tooth colored, and then we can bond it directly to your teeth. There are chemicals that we use so that the adhesion is so good and they look very aesthetic. You would look like your own teeth. Yeah.
And again, taking it from you, you said the cost would range somewhere around 5,000 rands, isn't it? All right. Okay, let's leave it there. We go for a break. When we return, we'll wrap our discussion on cosmetic dentistry. Please stay with us. Welcome back to Health Talk. Now we'll wrap up our discussion with our two special guests, Dr. Matshidiso Mutupi from Wits University and Dr. Khomoso Sepeng from Pretoria. Ladies, there's so much we can talk about, but unfortunately we have very little time. Now, 1 minute each. What is your take-home message to our viewers?
For me, I think what is important is prevention. Prevention, prevention, prevention. I see a lot of patients, like I said, with cancer, which could have been either prevented at that early stage, if one got it at an early stage. And eventually we have to do big reconstructive work where people lose their jaws, people lose their facial structures, and it's really sad to see such happening. So I would like to say to people out there, dental checkups are not only for the teeth, but they are for your general health.
Great stuff. Dr. Sepeng, your take-home message?
Okay, yes, prevention is the best thing for our teeth, coming for regular checkups to our chosen dental practitioners so that they can screen and see whatever it is that you need. And next month being Oral Health Month, I would urge our general public out there to go to their dentist, to a dental therapist, to an oral hygienist, to go and have their regular checkups and for them to see what is it in there that they can be helped with.
Mm-hmm. We spoke about sugary stuff and sweets earlier. Advice to parents?
Children need to be brushed their teeth from as early as the teeth erupt. We don't want to wait. Parents usually think that the milk teeth are just there and then they can be taken out. It's important that parents save those milk teeth because they keep space for the permanent teeth and they help the children in functioning, in eating. So we should take care of the children's primary teeth and not neglect them and hope that we'll do a better job with the permanent teeth.
Okay. All right. Well, that's where we're going to have to leave it, I'm afraid, because we've just run out of time. And we say thank you to our guests, Dr. Matshidiso Mutupi, a prosthodontic specialist from Wits University, and Dr. Khomoso Sepeng, a cosmetic dentist practicing in Pretoria. Okay, so we're going to have to leave it there. That's how we come to the end of our show this week. And remember that you can catch us again during our repeat slots at 2 p.m. and 10 p.m. in the evening. And again, by the way, Sunday mornings at 5 a.m. So until then, We're back next week, same time. Until then, please do take care.